So um, some of this stuff might sound like common sense, but you'd be surprised at how hard it is when we are under stress and when people are uncomfortable with the topic, which is really how it is with death and dying. So the first thing that we say is be honest and encourage questions. So many of us, we consider sort of trying to keep painful truths, such as the death of a loved one, hidden from children in order to protect them. And in practice, though, this really can only serve to typically prolong a period of uncertainty and anxiety in children. As I'm sure a lot of people here know, they have a keen ability to pick up on subtle emotional changes or shifts in adults and at home and in the environment around them. And so by sort of avoiding telling them what's going on, we actually sometimes add to the confusion and fear by doing that. Um, you want to let them know that any feeling that they have is okay. As anybody, it sounds like a lot of people here have experienced the death of somebody they know and the loss of a loved one, and we know that grief is a very complicated and non-linear process, and there's a lot of emotions that come with that, and we want them to know that any emotion that they have, any feeling that they have, is okay. When we're talking to them, we want to follow their lead. The kinds of questions and concerns that children have can be very different from those from adults. Sometimes giving children too much information can overwhelm them. It's usually best to let them ask questions and then answer in the best and kind of most developmentally appropriate way you can. And I'll talk a little bit more about that. And when I say developmentally appropriate language, there's some key points that I think apply to kids of all ages. First is we really want to be kind of direct. We want to use the words like death or dead or died, rather than euphemisms. We want to avoid phrases like things like passed away or they're gone or we've lost them. Kids tend to be very literal, and this kind of fuzzy language can kind of leave them feeling anxious or scared or confused. Or conversely, especially in young children, may lead them to believe that the deceased will come back and that death is not permanent. Um, Depending on the age of the child, children can benefit from having the cause of death explained to them. It can be done again in simple and clear language and developmentally appropriate. And we'll talk about that because there's a risk that if children are not given a clear explanation, again, they may not understand the permanence of it. They may blame themselves. They might engage in kind of magical thinking. And I will talk a little bit more about that in a little bit too. And when we do talk to them about death, it's sometimes helpful to link it to any previous experiences that they've had, such as, I know that this was mentioned in the chat, the death of a pet or even the death of a plant. And it's important that the child has the opportunity to talk about death in order for us to facilitate their understanding of it, and that it's irreversible, that it's universal, and that it has a cause. Especially because if you think about video games or cartoons, they often portray death as a temporary state, and that can be very confusing for young kids especially. You want to remember that every child reacts differently, and children also tend to react in a more sporadic way than adults. So for kids, some will cry, some will ask questions, others might not seem to react at all. They might go back to playing the game that they were doing or whatever activity, and that's okay. Again, we don't want to judge their reaction. We don't want to assume that they're not processing it. It's just really that they might be processing it in different ways, and they also might show at different emotions at different times. And so it's okay to just offer them hugs or reassurance, to be with them and just sort of create a space where you can let them know that, one, their feelings are okay, and two, you're available to answer any questions when and if they're ready. You might find with younger kids, especially, they will ask the same questions repeatedly. And this is normal. It's, sometimes I've had people be like, are they in denial? Are they not accepting? They're not adults. They're not like us, right? It's just like the same kid, the same reason why a young kid might ask you why bubblegum is pink 20 times again. They're going to ask the same questions over and over again. And the best thing you can do is just really answer the same questions simply and consistently every time. It's not because it's not some sort of deep unconscious thing that they're not getting. It's very developmentally appropriate for them to do that, the same way they might ask the same questions, why, as we all know, over and over again. They're going to do that about this too. They don't process the same way as adults. And I think it's important to keep in mind that we're not sort of projecting some of our adult complexities onto them. And as I mentioned, they will be much more sporadic, I think, in how they experience, hearing the news that someone has died. They can, like I said, they can be very happy in one moment, sad in another, unreactive, and sometimes this can seem a bit distressing or upsetting to adults, especially if they don't react or they seem unfazed by it. But it's actually quite normal. And again, it might just take some time for them to digest. And this is where, again, the repeated questions come in and the repeated check-ins, which I'll talk about as we move forward. But it doesn't mean that they don't care or that they're not processing it, but it's a very typical reaction for kids. And especially for young kids, don't be surprised if young children are really mostly concerned about themselves. It's how they are. So for a young child, if they hear of the death of a loved one or a death of someone they know, their first question might be like, well, who's going to teach me? I think someone said a dance class. Who's going to be my new dance teacher? Who's going to pick me up from school? Who's going to play my board game with me? Those will be the kinds of questions, and that's very age appropriate for them. The world sort of begins and ends with them, and so that's how they're sort of processing the death of somebody. Maintaining routines for, again, this is for all age groups as much as possible. And I know that this is hard depending on the nature of the circumstance and who it is that may have died. But as much as you can, you want to maintain the routines. Grief takes time. Anybody who's experienced that knows. And children really benefit from the security of regular routines, knowing that life goes on. If you can't maintain routines, it's always helpful to expect them to know help them to know what to expect. So if it means like a change in their life, you might want to head off any worries or fears by explaining what will happen. For example, Aunt Sarah will be picking up from school instead of grandma. Or it might just even mean changes in the house. If there's been the death of a loved one, perhaps relatives are coming to visit and will be staying in their room or going to be in the house. These are things you want to prepare them for. Or as anybody is also happens as in the death of extended family, we might need to travel. And so if a parent needs to be away for an extended period, it's good to let them know who will be staying with them, who will be, how will you be keeping in touch? And let it be very specific. I'll FaceTime you every day. I'll be back on this day. You can make things like a little calendar. So it's not just about, somebody close to them, but sometimes the death of somebody in their orbit can really change other routines that aren't, quite as, maybe not quite as impactful as, let's say, the loss of a parent or someone very close to them. But these are the things that we want them to know and help them prepare so we can, again, maintain the routine as much as possible. It's okay to let them know how you're feeling within reason. Sometimes I think we try to protect or shelter kids by attempting to hide our own sadness or grief. But kids, as I mentioned earlier, they invariably know that something is wrong, especially if it's a parent or loved one or sibling. And if they don't know what's going on, they might feel alone or confused. And also sometimes hiding your own grief might make them feel like they can't express their sadness, or that their own feelings might be strange or odd. So it's okay to let them know that you're feeling sad, that you're tearful, that you're missing somebody. You don't need to let them see you at your most upset moments, because we don't want them to start to worry about you, and how you're coping. But it's okay to be honest with how you're feeling, and it's a way to model for them that all different emotions are okay, and that also sharing those emotions is okay. And the whole cycle of the things. Sometimes I feel sad, but then I'm thinking of a good memory and I'll be laughing. And then sometimes I'll feel sad again. It's okay to model that cycle for them. And also just keeping in mind that, as a parent or a caregiver, that, if you're grieving the loss of somebody significant, that one of the best ways you can do to help your child is also ensure that you're taking care of yourself too. And that's sometimes how you can provide, if you're giving yourself space for your own grief, to process it, that's just as important, and allows you to help do that for your children. And another big thing is as time passes, or even in general, we don't want to avoid mentioning the person who died. We want to share those stories and memories. Remembering is a part of grieving. It's a part of healing. And you can help your child remember that person. You can, it can be as simple as sharing memories of the person who died, or just even bringing up their name, so that your child knows it's not taboo, to not mention that person, that it's okay to say their name, to talk about them. If you're comfortable, you can keep photos around. For older kids in the days and weeks ahead, you might want to encourage them to draw pictures or write down their favorite stories, to help them make memories of their loved one. Recalling and sharing memories helps heal grief and activate positive feelings for the person that has died. And like for all of us, I was about to say, give your child time to heal from a loss, but give everybody time to heal from a loss. Grief is a process that happens over time, and it fluctuates. As I said, it's very nonlinear for kids and adults. And so we want to keep having conversations about, to check in with your child about how they're feeling, how they're doing. Healing doesn't mean forgetting about the loved one. It means remembering the person with love, and letting loving memories, stir good feelings. And so it's okay to keep checking in with them, at various points, because again, it is a nonlinear process. Susan or Gabrielle, is there anything you want to add before I move on?
I think that was brilliant and a lot. And I think one of the things that's really hard is, mm-hmm. and this comes from a friend of mine who just passed, and her son is about my age. She was mm-hmm. a lot older, but holding space for yourself to grieve and mm-hmm. still comforting your child. It's hard. It can be mm-hmm. really, really hard. And for those of you who might not be on Parksville Parents, we have a motherless mothers group, and know that there are things that will come up as you have a child. And we also have a meetup of fatherless fathers. And so parenting adds this whole other layer to grief. Mm-hmm. But even taking a walk in Greenwood Cemetery or Prospect Park and just letting yourself feel those things. And my friend spent a lot of time while his mother was dying in the shower crying, because mm-hmm. he didn't feel comfortable being, too falling apart in front of his child. He did some of it, but that was his private mm-hmm. space. Mm-hmm. So for what that is. Yeah. Moving on.
Okay. So I wanted to kind of go through some of the age groups, in case, some of these are currently going on, or depending on what the age of your children are. And again, please, Gabrielle and Susan, please chime in if there's anything you want to add. And again, as Susan said, this is a lot. So I know it's a lot, and it isn't, right? Because it's so hard to cover everything. But I just, I think the takeaway from this is that is always to kind of keep in mind the age of a child, and what, again, a lot of times I think when it comes to death and to a lot of complex things in life, we have to remind ourselves that kids are kids, and we're adults, and they don't process things maybe with the level of complexity or abstractness that we do, especially for young kids. So along those lines, starting with the 0 to 2 year olds, and you know, zero, oh, I can't believe we're talking about babies, but yes, we are talking about babies because infants can grasp that adults in their life are sad or angry. They can't understand perhaps the concept of death, but they do pick up on those changes that we've mentioned. And so they can pretend, you know, experience potentially feelings of pain and loss. They may search repeatedly, as I put in the last bullet point, for the deceased. They may need to be told repeatedly that the person will not be returning. And these are very appropriate reactions for them. And they, you know, typically don't understand the abstract concept of death, nor do they necessarily understand the permanence of it. So they usually need a lot of repetition and reminders. They, you know, cuddles and hugs, and potentially, again, being told repeatedly that a person's not returning. And it's important for this age group, especially, that special memories and photographs are kept for them as they grow older, to help them learn about the person that they've lost, especially since they may not remember that many things. And as I said, you know, in the first slide, but again, especially for this age, a consistent routine is really, really important. Okay. Anything else, Gabrielle or Susan? 2 to 5 year olds also at this age also typically lack a real understanding of death and the permanence of it. They're very present oriented, and they may not really understand that death means forever. They may see, you know, death as reversible, non-permanent, and they may invent sort of magical theories as to what causes death, or believe that their actions can impact outcomes. And so, you know, sometimes they may need to be told that people die for a variety of reasons, but not because of anything we say or do. This age also may ask the same questions over and over again, and we want to just be patient and consistent and reassuring. And we want to provide honest and brief answers to their questions. And again, lots of reassurance and affection. And also, when I say those honest, brief answers, you know, we want to be this, especially at this age, kids tend to think much more literally. So use of language is extremely important. They, you know, statements such as like, we've lost him or her, or they've gone away, or they've passed. Those can be very confusing for them. So really, really keeping the language simple and using words like death and dead, and, you know, relaying the importance that that person wouldn't be coming back is important at this age. And also for this age, maintaining routines is important as well. And especially, you know, at this age, their play will often be an outlet for their grieving. And so you might see those behaviors come up in their play. And again, those range of emotions that might be happy in 1 minute, sad, aggressive, and that's all very understandable and typical, and for it to fluctuate. But you'll see a lot of it in their play. Okay.
Preeti, I would say one of my professors died of a brain tumor, and I babysat their kids a lot, and they were in the 2 to 5 year old range, and they said, well, don't worry, Daddy's watching over you. And they were extremely, you know, that was a concrete word. I'm in my bed, they're watching me, you know, he's watching me at night, he's watching me. And it wasn't a comforting thing, it was a creepy thing.
Yeah.
So whether or not you use certain language, kind of step back and say, how can this magical saying actually backfire? And that's just a good example of one that did.
Right. And we certainly want to be, you know, we want you to embrace whatever cultural or religious values or aspects that might provide your own, you know, might support your own grief process. But again, I think with kids, we also just want, we have to understand that they might take those things literally. And so I think if you do use that language, then being explicit in terms of what that means to you. And you know, this is where also, you know, so many different people in life are helpful around helping to explain things in a developmentally appropriate way. Whether it's a pastor or a rabbi, anyone in your, a mom who might be able to, who knows how to kind of maybe embrace some of a death doula. I see Gabrielle has mentioned. There's people who really can, I think, take those values and that are important to you and relay them in a way, help you come up with the language to relay that in a way to the children that won't be so confusing or creepy as Susan just said, but also provide, have the ultimate intent, which is to provide comfort. And, that goes along the lines with a lot of things. And again, we couldn't cover everything in this talk, but I come from a medical background. And so much of the work that we did, I was in a pediatric cancer center, was really working with families on not even just around the bereavement or death and dying, but even just around explaining diagnosis. We had so many tools to be able to talk about what a diagnosis meant, and pictures and books and different arts and crafts that we would, use to explain things like blood disorders. And there are people out there that, specific to whatever might be going on, like a brain tumor, to use Susan's example, that can help guide you on how to, what kind of language around those specific issues would be good for a child. One thing I didn't mention, I can't remember, I didn't put this on the slide, but another thing to consider with this age too is that they tend to have sometimes brief but kind of intense responses, and it's not uncommon for kids in this age group to really kind of regress to earlier behaviors too. So things like thumb sucking may reemerge, bedwetting, sleep problems, irritability, confusion, and again those regression to some of those younger behaviors can happen in this age group, and it's not uncommon, and we work through it the same way you work through it when they may have had those issues when they were younger. But again, a lot of it is just reassurance and providing support, and recognizing that sometimes those things are going to be just temporary. Right, 5 to 8 years. So this is where we get a little bit more variable. Kids in this age groups, especially in the younger end, may still see death as reversible, but kids at the older end usually understand that death is irreversible. They may ask, kids at this age, because they're getting more knowledgeable, they may ask frequent questions about death, and they might become preoccupied with thoughts of death. They might want to understand what happened. They might, especially for this age, let's say it's the loss of a grandparent, they may begin to worry about their own parent. Could this happen to you? And so they tend to need a lot more explanation, again, within an age-appropriate day. In an age-appropriate way, and they might need a little bit more explanation around. I see someone say, my 5-year-old asked if she will die too because her great-grandmother died, and so this is where, again, they might become, because they do understand more, but not but necessarily don't have that complexity or have that maturity. They might ask a lot of very specific questions, which sometimes can be disarming. But again, answering these questions honestly and directly. And yes, I see someone wrote, we have some of this too. Will you die? Will dad? Who will take care of me? And these are very kind of age appropriate things that you'll see at this age. And again, we stick with the idea of being direct and honest, and then helping to explain if there was a cause for somebody's death, what that was, why that's different from you or another individual in their life. They also they may engage in some magical thinking or believe that somehow they caused the death as well. So it's also, again, important to be direct and honest about what you share with them, and answer those questions, as I said, openly and honestly in that bullet point. You can, it's also for them at this age, they may experience things like nightmares, regression to younger behaviors as well, changes in sleeping and eating, aggressive play. These are all understandable reactions to kids in this for kids in this age group. They may even, attempt to take on the role of the person who died in a very childlike way. If a person was somebody who played a certain game, then they might try to take on that role. I'm going to do this, or I'm going to help with this because that's what so and so used to do. We want to encourage their expression of their feelings verbally, but also through various outlets, drawing, stories, talking about the person who died. Kids at this age engage in a lot of symbolic play, and that's okay for them to do that. It's also sometimes a good way to also help explain concepts to them. And once we get to this age group too, we want to make sure that, depending on how close the person is to them and how they're processing it, it's sometimes worthwhile to make sure that, their people in their school are aware, whether it's their teacher or school staff, just because, again, they might start to exhibit some behavioral changes at school or have trouble focusing or feel different than their peers. And we want to keep an eye on that, especially if it's the loss of a close loved one, like a parent. Anything else you want to add, Susan or Gabrielle? I know that you guys were putting some stuff in the chat.
Yeah, we've had a lot of these questions come up on Parksville parents. My mother died, and now my child is worried that I'm going to die, and so what we've done is compile the answers that people have given to those. And so those I'm just putting in, and we'll send these out later as part of the resources.
Right.
But
there's just so many. There's only so much we could cover today, but I think, some of these resources are great. And the one thing I guess I also want parents to take away is, if your child starts asking you those questions, that is a perfectly normal and healthy response. And it's part of how, we learn about all sorts of concepts in the world, how we sort of learn about a concept, and then we make differentiation between, the different nuances of it. And this is what they're doing with the concept of death. And so it's understandable. And so the thing, sometimes when kids will ask those questions, the knee jerk might be to be like, oh, you don't need to worry about that, or I'm not going to go anywhere anytime soon. And that's what we kind of want to try to avoid, because that can indirectly send them the signal that they shouldn't ask the question again, or we're not really helping them understand the concept of death in that case. And so, and I'm sure I've done it in the past too, and it's just a knee jerk. And so sometimes when kids ask those questions, it just makes us a little anxious inside, and so, remember that's our anxiety. It's not theirs. They're just sort of asking a matter of fact question, like, why is the sky blue? And so we have to look at it that way. And one thing I also like to tell parents is, you can always buy time. It's not normal to walk around prepared to answer questions about death, right? That's not how most people want to live their lives. So if a child asks you a valid question, it's okay to say, that's a really good question. I can see why you might be worried about that, and I want to make sure I answer that in a way that helps you understand it. So let me think about that. Can we, and come back to it a little bit later. You understandably will not be always prepared to answer these questions, and so you can buy yourself a little bit of time. But in that statement, what you're telling your child in that moment by saying, that's a really good question, I want to answer that, I think Susan's putting, let me come back to that later, is you're telling them that the question they've asked is okay, you can handle it, that it's a safe space, and that you are listening to them. And that's really what they need in those moments more than anything, and that what you've now done is create a space where they know they can keep sharing and asking questions. And that's what you want more than anything, than always having the perfect answer, because there's going to be plenty of times we don't have the perfect answer. I'm a psychologist and do this for a living, and sometimes I have to think about what I'm going to say too, or I have to go back to it later and say, you asked me something, and I want to kind of revisit this because I'm not sure that I said everything that I should have said. It's okay to do that. We're human, and what you're doing is giving them the signal that it's okay to talk about these things, and that's what you want more than anything. Okay. 8 to 12. So a lot of the same things here, but at this age, obviously, they really typically understand the physical aspects of death and its finality. And because of that, they tend to ask pretty specific questions, and they might have a desire for detail. They also, because they're at an age where they're taking in more of others, they might also be concerned for how others are responding to death. They might want to know about what the right way is to respond, how to grieve. And so they're really beginning to have really more of the ability to mourn and to understand and recognize mourning in others. And communication sometimes, though, because they might understand more, but they still obviously don't have the sophistication and how to communicate about it, their grief may come in the form of things like physical aches and pains. And they also might have concerns about their own health, thoughts about their own death, their parents, if it wasn't the loss of a parent, and really kind of helping to differentiate, even like you would with the previous group, what are the differences in terms of causes, what happened, why it's different from somebody else. But again, they do start to really understand the finality of death, the universality of death, and mortality. And so for them to become a little bit preoccupied with that and ask a lot of questions, and very specific questions, is not uncommon for kids in this age group. They also, some of the behaviors they may exhibit is some of the more challenging behaviors. So again, I keep saying this phrase, but regressing to younger behaviors, behaviors that are typical of younger children. They might exhibit more school problems, have trouble focusing, following through with homework. They might also start to feel maybe different than their peers. So they might have some social difficulty, or they might withdraw from friends or act out. They might start to become kind of concerned again with their own body, and their own health. And so this is where, again, being open and honest, and also involving, collaborative partners like their school, to keep an eye on them, especially again, if it's the loss of somebody very close to them, so that we can monitor for any changes in their behavior in school, socially, academically. And they're also at an age where they might need reassurance about changes in lifestyle. They're maybe starting to be at an age where they might worry about things like finances or housing situation if it's a parent, or changes that they're going to understand some of the changes that might accompany the loss of somebody significant in their life. And again, for this age, same thing again, we don't want to avoid talking about death or answering questions. They really, I think at this age, need an opportunity to talk to a trusted adult, and they really need that opportunity to know that that adult isn't afraid of them asking those questions, and isn't avoidant of asking those questions. And again, this is where you might not always have the perfect answer, but you can always buy time. But you want to create a space where they know it's okay to ask and to talk about it, and be open with how they're feeling. And also at this age too, they can, it's great to encourage them to talk, but it's also okay to give them some alone time too. You want to be present, but you don't have to be on top of them. And so allowing them a little bit of own time to process is all right as well. Susan or Gabrielle, is there anything you wanted to add?
Yeah, no, I mean, I'll just say I was, like just turning 8 around 9/11, and had an uncle that was in the fire department. And, there was a lot of questions I had, and I did want details.
Mm-hmm.
And I think I remember a time, my mom didn't want to bog me down with the details, but I actually found a great deal of comfort in them. So I would ask, I would, be like, no, I want to hear if we heard from Uncle Vinny today or not, or, what's
Mm-hmm.
going on. So, yeah, I will say, because I do remember very vividly how my brain was working at that time. I wanted that. And then I was communicating that, even if it was messy and hard. And then I saw, and witnessed my parents and my family kind of feel a little sticky about it, but then finally give in,
Mm-hmm.
and be like, all right, fine. Like, we'll give you details in the most appropriate way that they saw fit.
Yeah.
So yeah.
And that's the thing, is they will ask a lot of questions and specific questions. That doesn't necessarily mean that you need to give like a a dissertation for an answer. Like you can just add, sometimes they have the attention span of like, 30 seconds. So like it can be a simple answer, but it has to be a direct and clear one. It doesn't have to be the ins and outs, but something that answers the question. All right, so the next slide, our teens, ooh, they're tough. Teenagers are particularly vulnerable at this stage because they really, at this age group, they try to solve problems themselves. And as we know with teens, they might find it difficult to seek help and support from adults, particularly parents. And it's hard because they understand the concept of death, but they still don't have the emotional maturity to deal with it. As even the most mature teen, they're still a teen, right? And so I think it's one thing to we want to encourage them to talk, but we also know that it's pretty normal for teenagers and adolescents to have difficulty talking to parents. And so we want to give them the opportunity to talk to a trusted adult or peers and encourage them to talk, if not to you, but to friends or a teacher or even a therapist if you feel it warrants that. School and other activities, can provide some security, but they might feel isolated or different from their peers, given, again, that the nature of the death and who it was. And depending on, how their grief is manifesting, they might feel overwhelmed by exams or coursework. And so, these are things we want to keep an eye on. And again, this is where partnerships with schools and other people in their life are really important, especially because teens tend to be a little bit more closed off in terms of communication. I think we want to allow them the space to mourn and respect their need to kind of grieve in their own way. And again, it's sort of being present, but not being in their face constantly. Checking in is okay. Saying, I'm here if you want to talk about it. These are all ways to let them know that you're there and you're present, but also even giving them the opportunity to talk to someone else if you feel it warrants that, because you're letting them know that you're want them to be able to process it in whatever way is most comfortable for them. They might, though, again, depending on the nature of the loss, they might exhibit more extreme emotional or behavioral changes that we might typically see from young adults or adults. Some denial, some regression, maybe risk taking, acting out, and so these are things also. This is where. This is where some of that emotional immaturity comes in, because these are some of the ways they may react. And even though they might have the cognitive ability to really understand the death and what has happened and the permanence of it. We want to, I think, not try to attempt to make it all better for them or dismiss their grief, but allow them to mourn, be available, but, respect their need to grieve in their own way. We want to, I think, also avoid burdening them with adult responsibilities or expectations. So I think as kids get older, we want to, we sometimes hear these phrases like "be strong for your mom and dad," or I think we referenced this one before, "you're the man of the house now," things like that. I mean, again, we really still want to acknowledge that they're still a child, and we don't want to put adult responsibilities onto them and make them feel overwhelmed or burdened with that. And we're going to talk a little bit more about this, but adolescents, can often need a choice with regard to funeral and subsequent life changes. And so, how they want to be involved. And we're going to talk a little bit more about that, and Gabrielle will. But teens are a difficult one. And so, this is where I often find that if you feel like you need outside support, because if they're not engaging with you, or if they're isolating or withdrawing, it's a helpful thing for them. Gabrielle or Susan, anything you want to add?
I'll throw in another personal experience. So my uncle had died when I was 13, and I remember my great uncle rather, and I remember going to school and telling one of my friends, and they were like, "Okay, it's your great uncle. What's the big deal?" So I do think this is a really important time as well to talk about like family structure, and that families look differently, right? So my family, like the great patriarch, It was like, this big part of our family, had died, where other families, maybe they'd only met their great uncle once, or, didn't have a relationship. So I was pretty confused about how to grieve, and I didn't feel like my grief was necessarily valid. But then once I spoke to my crazy large Italian family, I had realized, oh, okay, wow, like I can be so grateful that this particular relationship, some people don't even get to form a bond with them, but I had. So school had become this interesting space where I got to teach and also like learn about those social dynamics when it came to a loss around this age.
Yeah, that's a really good point. And I think sometimes when these things happen too, helping kids also understand how other people's reactions might not be different. It might not be as supportive as they need, or even helping them understand that sometimes when we share things like this with other people, they get uncomfortable, they don't know the right thing to say. And so yeah, that can also, again, points to how sometimes kids at this age particularly can feel isolated from their peers if if their peers can't really appreciate what they're going through, if they haven't had an experience like this.
I would also add to what Gabrielle said, and my father-in-law died, and he was older, and he had some dementia, and he wasn't very interactive with my girls, who were 16 and 15, or 16 and 14 at the time. But most recently, a close friend who was only 48 died. And this was somebody we've spent Thanksgivings. Yes. So even if it's a family member, that might not be as impactful as somebody who they spent more time with. And I'm going to be devastated when one of my cats dies, because my one daughter is so attached. So don't belittle any loss. And even I was having a conversation with somebody today, and there's lots of different kinds of loss, and it's not necessarily death. But if you had a nanny, if your family has had a nanny, and the nanny goes off and gets another job, there can be, a lot of feelings of grief and loss because they're not around anymore. So just understanding 100%. That grief is not just death. Grief is not just people. Grief is not just somebody that's in your family.
That's true. Very, very true. Very, very true. Okay. So then the next slide, if you wouldn't mind moving us forward, Susan. So, and this is where I'm going to cover a few things. I'm going to hand it over to Gabrielle. But preparing for funeral and services, it's beneficial for children to have the choice to attend services. The funeral is an opportunity, or whatever services you may have, for family and friends to say goodbye to a person they loved. And it's good to give children that choice to attend and how they want to be involved in the service. But again, important not that they feel burdened with responsibilities. If they attend, we want to have them to have access to a trusted adult who can answer questions and be supportive. In some situations, this might be an aunt or uncle or someone who's not in the immediate family, who might be maybe more available to answer the child's questions while a funeral is in progress. I think of an example, when my uncle passed away, and my cousin, who's a bit older than me, had elementary and middle school age daughters at the time, and obviously her and her sibling and my aunt were very involved with the services, and of course visiting with all the people who attended, and so I was really charged with being with her daughters for the day. And I think that was an important thing, because I was sort of their person to answer questions, to just even get things that they needed, but that they had this trusted adult who they could talk to, or even cry to, or ask questions, or one of them just wanted me to like fix her shoe, things like that. And those types of things will be important. if you know providing careful preparation of what to expect and what they will be seeing during the services. So you know, and what that might look like. You know, for many people, even adults, sometimes these types of events or these types of events are the first time they're experiencing it. And so for children, you know, as much as we can prepare them about what it will look like, what the room will look like, particularly if in certain funerals, if it's an open casket, we want to give them the choice of seeing the body. And if we are doing that, we want to give them careful preparation for such an event. You know, descriptions of the coffin, the room, the body, what to expect, what it'll look like. And again, we want them to have access to a trusted adult that they can ask questions or express emotions or any reservations or fears. And we want, you know, some children might need permission to touch the body or not want to, or that they may express that they may not want to. They may want to put a letter or a drawing or a favorite toy in the coffin. And you know, Gabrielle will touch on that with some of the things that she's seen in her work. And if your child does attend, it's okay to invite them to participate in the services and have a role in how, giving them a choice in how they want to participate. You know, having sometimes a small active role can help kids master unfamiliar emotions and maybe like feel, you know, help them manage a very emotional situation. You know, you might invite them to read a poem or pick a song to be played. It doesn't have to be something that requires them to kind of do something in front of other people. So they don't if they don't read the poem, maybe they pick a poem or scripture that's read, or they pick some of the music, or they help select photos that might be displayed in a memorial or hung up. And again, you know, they might want to make something that's displayed or to put inside a coffin. And so giving them these choices of how to take part, and, you know, if they want to take part, and how allows them to be a part of the process without overwhelming what they might be emotionally ready for. And Gabrielle, I know you have some slides coming up that just shows some of the things that you've done with the kids, if you want to add to this and take it from here.
Yeah, absolutely. So it kind of what you're getting at, like, these are some great pictures. These are alternative containers, kind of cardboard caskets, primarily used for cremation. And this is a great way, even if, you know, if there's a viewing and the child doesn't necessarily want to go up to the casket, but wants to still engage in ritual, look and research and think about what those ways could be. Here, you know, we see a bunch of kids drawing, coloring, adding photographs, writing messages to the deceased right on the alternative container, the casket there. So there are so many ways to bring people into the process that doesn't necessarily have to look like the normal way. It doesn't have to exactly be, oh, well, you know, the adults, we all go up to the casket and we put the mass card and, you know, whatever. There have been many times where I've been the one at the back greeting all the family that's coming in from all over the world. So, you know, other family members can be at the casket and, you know, be more openly mourning. And, you know, another really great way to bring in kids to it too is I've done intuitive drawing with with my little cousins, that, you know, when a family member dies, just processing feelings and things like that. Or, you know, what would you want to say? Like, do you want to say a poem like you said? Or there are just so many ways. So I just implore everyone to think, I'm outside of the box, but right here they're thinking on the box. But yeah, I think the next slide has a few pictures as well. But there's so many ways. And yeah, exactly. So interacting with objects or art, or just trying to bring them into the ritual and asking them, right? Saying, all right, what parts of it do you want to be involved in, or which parts of it may be scary for you? You know, my cousin stands firm by this. She did not want to go up to the casket of her father. And, we talked about it recently, and she's like, no, I still had a role at the funeral. And I was asked, like, what do you want to be doing? And she didn't want to go up to the casket, but she did want to interact with people that knew her father. She did want to take a moment and have those moments and greet people and, be the first one at the casket at the cemetery, but wanted out of that part of the ritual. But when she was asked, what can I do? And we provided her options. She was able to say, that feels safe. That seems scary. That feels good. That doesn't feel good.
I think it's also, I see the message in the chat. We were asked if we wanted to go to the funeral.
Yeah.
And I would caution, my father was dying of a brain tumor, and we went to go visit him. And as I was going in with my sister, my mother was coming out, and she said, well, he's asleep, so you won't really get to interact with him. And that would have been the last time I saw my father. And for a long, long time, I felt like I should have done that. I should have gone in anyway. Similar to this, I should have been at the funeral. I should have gone, even though I said I wouldn't. And later I had the opportunity to spend time with a man who was dying of cancer 40 years later. And my decision, or my upset from when I was 17 through until I saw this other man withering away, I changed my mind. I changed my mind, and it turned out that I actually felt like, it was okay not to see him in such a state. So, but I hear you, Nancy, and I feel like, giving the kids option in some cases makes sense. But I like what Gabrielle is saying, is maybe there's something that they can do that feels like, putting together a photo album, lighting a candle, so that you're not forcing them to go, but at the same time, you're not also limiting them in the future to feel like they had a part in it. Does that make sense?
Yeah, I think also, and I saw that one come up too, and I think it's a valid question. And it's hard to cover every permutation of this. I agree that maybe like the question of, do you want to go to the funeral? Anything that's unfamiliar to a child, they're most likely going to say no to, right? Do you want to go to X, Y, or Z? And so I think this is where the clear and the directness is, this is what the purpose of it is. This is, this is going to be, when an adult will say to such young, this is something we're going to be doing to honor daddy's life, and to tell good memories, and to say goodbye to him. And so I think that's when it's not just about, do you want to go, yes or no, but it's about sort of explaining to them what it is, and then asking them how they want to be involved. So will that be hard for you? Do you want to have a safe space to sit quietly? Who would you like to sit with you at the funeral? So I do agree that yes, at such a young age, that is maybe a hard question for them to answer. To answer that, and to kind of pose such a big decision on them. But I think it's not just as simple as saying, do you want to go? I think it's more about really walking them through what it is. And if it's important to a family that they be there, then the choice is really like, how do they want to be involved, right? We do want to respect a parent's or a caregiver's, it's also, desire to do what they feel is best for their child and for the long run, right? And so I think it's a way to just, I think, make a situation that is incredibly emotional and confusing, and hard. And so we want to give them some knowledge about it and some opportunity to find a way to be involved in a way that they're comfortable with. And so it doesn't always have to be as simple as, do you want to go? But, going doesn't necessarily mean staying home and going, be like, do you want to go inside this room? Would you rather wait with somebody here? And, sometimes people can go and say goodbye. Family members can go and say goodbye independently, not with everybody. So I think there's a lot of ways to phrase that conversation with options that are within a realm, and then ways to invite them to be a part of the process. But usually I think you overcome that by, again, giving them information about what to expect. I know there were other questions, and I don't know. Hello? Is everyone still there?
Yeah, I'm wondering, Gabriella, if you want to go ahead and do some more, and we'll come back to these last questions.
Yeah, sure. I think the next slide is maybe some other books. And then I'm just going to put in the chat here just a quick list of also films that can, help frame and guide conversations about death and grief. But if you want to talk about the books, Doctor.
Yeah, I mean, I think, I'm sorry, if you want to move the slide. I mean, they're just so many things out there that I think also help explain the concept of grief, because again, we can appreciate that I've used the phrase developmentally appropriate language, and as a neuropsychologist, I can appreciate that that's more familiar to me. And when in doubt, there's always some really good books out there that can help you along. And so, these are, and again, it doesn't always have to be at times when it's the loss of somebody, especially close to them. But, there's a lot of opportunities to teach children about loss and death through, again, loss of a plant, a pet. And so these are some titles. There are so many out there, and to sort of help, I think this is a great way for kids to understand some of these concepts. Some of these books are fully available online in their entirety. And there's even now, even some of them there's videos. I know we always just include books because we know that sometimes we want to limit some of the screen time, especially after the pandemic. So we wanted to give some tangible options, and these are some really nice ways to help introduce this topic and to review this topic. And again, you can always buy time, right? You can say, these are really good questions, and I'm trying to think of the best way to answer them, and so I'm going to get a little help. I'm going to talk to so and so, and when I worked at the hospital, the parents would say, we're going to go ask Dr. Preeti or Dr. So and so to help us answer these questions, or we say, I'm going to find us a really good book that we can read together. These are ways to buy yourself time, and again, you're showing them that you're not afraid to necessarily answer the question.